From retail to transportation and logistics to distribution centers and healthcare, our technology helps keep operations more productive and efficient. Now, our innovations are supporting a healthier and safer work environment and helping shape the future of your operations. Our operational intelligence software helps you manage devices and equipment and implement healthy work protocols throughout the workforce. Innovations like our proximity detection alerts for device-equipped workers reinforce social distancing, and our communication software is connecting workforces virtually, reducing face-to-face collaboration. Our workflow management software helps you meet new device and equipment cleaning requirements. And with real-time visibility of device chain of custody, identifying and tracing device handling help you comply with safety requirements. Our latest disinfectant-ready range of devices is built to withstand harsh chemical agents and demanding cleaning processes. With remote control and device system wipe technology, IT professionals are deploying updates at a safe distance, limiting in-person contact, and helping eliminate unnecessary on-site visits. Lastly, our customer counter software is helping manage building entry and exit points for better control of occupancy levels. Our technology is continually evolving to shape the future for a brighter tomorrow.
All right, so good morning, everyone. It's a great pleasure to welcome you all in our today's healthcare webinar, Frontline Revitalized, Leading the Future of Healthcare Systems, today, November 10, 2020. So I'm Ivy Buenaflor. I'm from Prime Sales Incorporated, and I'll be serving as your host and moderator in this online event. In behalf of my fellow organizers, Honeywell and Brinsil, thank you so much, everyone, for sharing us your time, despite that we know that the frontline industry now have a lot of priorities because of these challenging times. But we really worked hard to assure you that today we will bring you the valuable insights and quality learning experience through this event. So just a quick introduction as well. Over the past few months, we have actually witnessed through the various media channels and through our very own eyes how our healthcare systems were actually reshaped by unforeseen circumstances that brought tremendous pressures for the healthcare industry. Hearing and understanding those challenges, we believe that this signaled a call for a new wave of healthcare innovations that will empower our frontliners with enhanced productivity, streamlined workflow, safer working environment, and at the heart of it all, a warmer and seamless patient care. That is why, ladies and gentlemen, Honeywell, Prime Sales, and Brinsil Storage Systems, we collaborated in order to breathe life to this webinar. And today, I would also like to acknowledge the presence of the Pharmaceutical and Healthcare Association of the Philippines, or the PHAP members. Thank you so much for supporting our event, especially through the help of Ms. Maha Hipolito. Thank you, ma'am. And we are so grateful and excited to share this undertaking with everyone. Yet at this point, on the other hand, we would also like to understand what is it exactly that interests you as our audience in joining our webinar today. So at this point, I will be launching a poll, and I encourage everyone to please share us your thought. So in just few seconds, I am now launching it. So what interests you the most in joining our healthcare webinar? Is it the healthcare trends and challenges? Is it the healthcare information system? Or do you have healthcare storage challenges that you wanted to address? Or perhaps you wanted to streamline your workforce productivity or to optimize your hospital or healthcare supply chain management or for some other reasons. Come on, guys, let us hear your thoughts in this one. Come on. Okay, so most of the answers is actually to understand what are the current healthcare trends and challenges. And then next is about the healthcare information system. Okay, perfect. I am now about to end the poll. Thank you so much for all your answers and for the participation. Actually, the reason why this is important is because those basically are the areas that will be highlighted in our today's webinar. Moving forward, so just to establish the order in our event, these are some of the housekeeping rules for today. Let me just reiterate. Number one, this webinar is being recorded and will be available or sent to you after the event. This event will run for 1.5 hours. And as you observed when you entered, everyone was muted just to avoid unnecessary distraction. So for the entire webinar, you guys will be muted. And then the Q&A will be after all the sessions. Please use the Q&A box to type in your questions. And then yes, we will share with you the presentation slides after also the event. And most importantly, please help us spread the word, make some noise in our LinkedIn, use our official hashtag, hashtag Frontline Revitalized Healthcare Webinar. Okay, so now that everything is set and ready, let's hear it from our first industry speaker. Let me just introduce his speaker's profile. Having the passion for technology and progress, he currently leads the mobility or RFID business and Honeywell Productivity in Workflow Solutions Healthcare Initiative in Asia Pacific based in Singapore. Over the past 18 plus years across 14 different markets, with his in-depth and diverse industry experience in the technology field, he has been helping customers digitizing and securely mobilizing their workforce for tomorrow's ever-changing business. Ladies and gentlemen, I'm now giving the screen to Mr. Freddie Fab. Good morning, Sir Freddie.
Morning. Can you hear me?
Yes.
Okay, great. Thanks, Ivy, for the introduction. So, hi everyone. Thanks for joining us today, this morning actually, for this session today that we have. I packed in quite a number of content for you, but we started today with a very, very good news that we heard over last night. That Pfizer actually announced that their vaccine is 90% effective in protecting every one of us from the coronavirus. So great achievement from the medical industry, the biomedical industry, but at the same time, it's a proven fact that technology has actually helped us get to where we are today. And obviously, it is something that we should celebrate our achievement. And moving forward, there'll be more things to come as we embrace technology in our lives moving forward. So let me start with the healthcare trends and challenges that we face today and tomorrow, and how it actually impacts the way Honeywell actually design our solutions for you and for everyone itself. Now, the trends that we see so far is always been on a macro level, on a global and regional level. Obviously, from Philippines standpoint, there'll be a difference in terms of the needs and the challenges, but all in all, it's the same. We're seeing a lot of adaptabilities to evolving regulations. So as you know, new introduction to technologies will drive new regulations. When it comes to, like, for example, AI, machine learning, obviously the use of ethical use of such technology will have to be in place to make sure that it's used properly. We continue to actually improve patient and clinical safety perspective, where essentially looking into workforces and workflows and utilizing them and optimizing them accordingly to improve safety for our patients. And of course, the large, long list of the changes in the healthcare ecosystem. Every country in ASEAN has its own public healthcare system, where essentially we strive to get things to drive better in terms of better data collection, better productivity for clinicians, quality of healthcare, better records management, improving mobility, and so on and so forth. So many changes that's happening today, and especially as we see during this pandemic, actually expedited some of the challenges, um, from a nice to have to become a must to have, and 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 more or less become an immediate requirement to implement. So we're seeing this across the region, as we help our customers to actually implement all these solutions. So from a short and mid-term perspective trends, we are seeing quite a bit of focus on these three areas. Number one is the care team collaboration. We see a need to have a faster and more dynamic communication mechanism in between the healthcare workers and, of course, the patients itself. That means we're talking about efficient nurse call, alert systems, and of course, collaborating with the various skilled workers to actually address the issues in hand. Um, the second portion is actually the workforce optimization, which is one big part in healthcare. In fact, a lot of you guys may know that fine tuning the skill sets, matching those skill sets to the relevant environments and the patients with the relevant schedules is quite a tedious task. With that, and especially when it comes to a lot of area where there's a need to quickly optimize that workforce, and there's a sudden surge like what happened for past few months. This optimization need becomes a heightened, where we talk about the healthcare workers being on a constraint in terms of providing the support at the front line. So this is one key area that, in fact, it was a long term down. Now it became a short term and an immediate requirement for a lot of our customers that we talk to today. And last but not least is the healthcare analytics, which essentially is the medical records, EMR implementation. So using it for better clinical decision support, and of course, finding the best and the safest processes to actually address the concerns out in the field today. From a long-term healthcare perspective, we're seeing increasing costs involved in a lot of matters. Um, and Philippines also is facing an aging population itself. Even though today it's just about 6% of total population is at that stage, but it's actually projected to be by the end of 2050, is about 16.5% of the population going to be taking up in the aging population itself. So we're seeing this trend in a lot of the matured in countries like Japan, even Singapore, and Australia, New Zealand. This is fundamentally a concern, where essentially it drives the need to address dementia and so on and so forth. So and of course to drive a specific requirement in terms of step down cares to actually address all these nursing homes and so on. So it is a long term in a lot of cases, but for Philippines as well, it's a long term plan to actually beef up that kind of infrastructure to address that in the coming years. As I mentioned earlier on, in terms of the AI and R&D, how we actually come to today in terms of the vaccination, the COVID-19 vaccine, is tremendous achievement. This is mainly using all this computing power that we have around the world to address the need. And of course, within just a few months, we're talking about a vaccine not been heard before, and at this high level of protection level. I mean, for example, flu vaccine is about 40% effective versus has been reported 90% for Pfizer's vaccine. So it's quite a outstanding result from the technology standpoint. And fundamentally, the last one, second last, would be the skills shortage we're seeing also in Philippines. Recently, also during this pandemic, there is a cut, or rather a requirement for skilled workers, healthcare workers, and of course, as I said earlier on, the crunch is there. In Singapore, we also see the same thing. We had to reskill some of our people to address the concerns and of course the need in terms of healthcare. So essentially, that is still a long-term but a continuous concern and a trend and a challenge that we always face moving forward. But fundamentally, the change of the requirements moving forward is human attitude and behavior. Essentially, is driven by we call it the self-serving culture right now that we have today. Like, for example, buying online. As we go through during this time, it is more evident that we have actually switched more towards self-serving in that process. So we're buying online for our groceries, buying books online, even dating, and so on and so forth. That drives in the next topic, which is basically the telehealth trend. And the telehealth trend is now, and it's actually being implemented by a couple of countries. In fact, Singapore is one of them that we actually leap forward in terms of using this. But obviously, this is one of the areas that it's not that easy to implement, especially when we need to make sure that the databases, the medical records are secure. And of course, everyone has a digital ID and so on and so forth. But this is a promising change in our environment right now, and also it's a promising technology or a solution for Philippines as well, as it is. Philippines has a lot of rural areas where it will help to encourage doctor to patient engagement high. I mean, increase that engagement higher, and provide that access to rural areas in Philippines, and especially when we talk about the situation where some of the natural uh, uh, incidents that came through, like the typhoon, those need help in terms of addressing in the field, and obviously with telehealth, this would help doctors to reach out to the patients in a most effective way, and cost-effective way as well. Earlier on, I mentioned about workforce challenges. This is still a concern over here. Again, as mentioned earlier on, is the workforce planning, productivity, matching off the various skill sets, and of course, the pay rules and the attendance policies as well. If you have governance that's required, that would actually provide some insights to that as well. So as you may know, Honeywell is pretty big in terms of what we do. We are into aerospace, petrochemical, supply chain solutions. But for healthcare, we are not new in healthcare in that sense. We have a various customer base in relation to patient safety. Obviously, for pharmacy and healthcare, we have customers in there in terms of the supply chain, and we even have cold storage um, uh, solutions for our customers to handle vaccines in cold storage environments. But for this session today, We have a large pool of patient safety clients on our portfolio, and from a holistic standpoint, we are just not a singular so-called a solution from an IT perspective, but we have various solutions where we talk about sensing solutions in labs, and ventilators made used in ventilators, building controls, climate control within the hospital, air conditioning, and of course PPE, which is basically a large we are one of the main or the main producers in the world for PPE, second to none. So essentially, we look at the hospital as an integrated hospital itself. From an infrastructure standpoint, we do have solutions like the nurse call systems, where essentially help to manage the healthcare infrastructure, provide alert systems to the nurses. Of course, building control, as I mentioned earlier on, from security management to fire detection and alert systems to climate control within the building itself. And it's a known solution out in the market itself. PPE, as I mentioned, we have a wide range of respirators, solutions, gloves, and so on. And of course, last but not least, I come from the IT side of Honeywell. Essentially, is the AIDC. We call it automatic identification technology industry, where essentially providing a traceability solution or portfolio to our customers. What you see today on this slide essentially is focused on two main things. The products or solution is focused on workflow improvement and optimization. So you can see from a barcode scanners and printers and mobile computers perspective, we have it all, including software, which I'll talk about in a short while. All these are actually certified and validated with the industry-leading software vendors like Epic and Sonia. So essentially, those we make sure that these solutions work safely together with all this software itself. Now, the solutions itself binds, as mentioned, the workflow binds into the 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 uh, the the rights of healthcare. As you know, five rights, six rights. It's all about rights in healthcare. So in medical administration, we talk about the right patient route, right time, right tool, right dosage, right documentation. Fundamentally, all these has to have a systemic way of capturing all this information and guiding the the clinician the right way to actually do this. So essentially, it is important. The technology side, the enabling side is a very important part in helping healthcare workers today. Ultimately, we talk about key patient safety goals, right? Identifying patients correctly, improving effective communication, improving safety of high-risk medication, the five rights, ensuring the correct site, correct procedure, and so on. And of course, the identifying hazardous environments to prevent patient falls. All these can be identified through our solutions, which I'll talk about in a short while. So to start off, from a solution standpoint, we look at the right identification, the right technology to identify a patient from administration to discharge. So with that, obviously, you need to tag patients from the start, and to one of the most efficient ways barcodes tagging the wristbands. And of course, with that, you can tag it together with the medications and the samples itself. How all these technology come in play in terms of throughout the clinical process is from, as I mentioned earlier on, administration, wristbands, bedside care, patient ID, specimens, and medication administration, laboratories from blood samples and slides, pharmacy for medication milk and transfusion, of course, stock room, the traditional warehousing way of doing things, supplies and shelf labels itself. So all in all, it's been used across the hospital in multiple ways. Benefits wise, I don't need to go too much of details, but essentially, as what the word says, automatic identification, is to help to identify things much easier and quicker, but also, of course, to find out how these technology can be deployed in an environment. As you can see on this picture here, it's a computer on wheels with the scanner on top, mounted on top. We call it a zero footprint mounting with a printer at the side as well. This ensures workflow to be very seamless and clutter free in the environment. In the healthcare environment, of course, clutter is a no-no. More things to disinfect, more things to organize, more things to maintain. So it's a no-no for clutter. So we make it very simple and very clean for a solution, of course, for customers, essentially to meet the 5 rights or 6 rights accordingly. Bedside labeling itself, as mentioned, also mounted at the side, can help to eliminate labeling errors. This is one area that even in Singapore, known for high standards of healthcare, had an incident of errors in terms of labeling. So it is not something that we can just ignore, but is something that it should be part of the flow of the process itself or the workflow to being integrated into what we do today, and should be invisible. So at least from that perspective, no errors of such would happen, because it is a life and death change or life and death error that we made. So essentially, it is important to have a bedside label for making sure that specimens are matching correctly to the patient itself. Then we talk about clinicians' productivity. So two things about clinicians' productivity. Number one is optimizing them, the right equipped or the right knowledge or the right skilled healthcare worker to the right patient at right time, and of course equipping them with the right information to be more efficient and effective moving forward, right? So this is critical because I know that clinicians today work very tirelessly, and they are our heroes in today's lives, and we want to make sure that we get the best out of them, and this is essential for us to move forward. So for that, we have a solution called the workforce optimization. Now, this workforce optimizer solution is actually used is used by the Singapore Health Ministry of Health and all the hospitals in Singapore, optimizing the healthcare workers and matching off essentially the skills and the patients accordingly, and of course simplifying time and attendance. The system is able to actually use analytics to automatically match trends and patterns where we could quickly allocate staffing immediately by the hourly level. So essentially, it is a breakthrough, and in fact, this is so successful that we a lot of the healthcare workers that I spoke to essentially said that they save a lot of time in the scheduling process and making sure that they're meeting the requirements accordingly. Um, when we optimize them to the right time and right patients, we need to make sure that they are equipped as well. So with that, handheld computers are used throughout the clinical side of things, bedside care, laboratory, and nurse calls, as you can see over here. But for more specific ways, we talk about medication administration, identifying the right patient with the right medication using the barcode, right specimen collection, right patient, right specimen label, right, and safely labeling it at point of contact. And of course, last but not least, automatic or documentation in terms of capturing the EMR, electronic medical records accordingly directly on the devices itself. Hence, improving performance and improving delivery of care. So everything is very seamless. Everything is very convergent, we call it. So the convergence of the device comes in play where all this information is in play. I mean, we do it all the time today with our smartphones. We will be doing it today with our clinicians, essentially. So with the convergence device that's pulling in all the information, and in fact is able to one of our solution, the nurse call, we are, and so Seville, we are able to integrate the vital monitoring and alerts onto the devices itself, so seamlessly connecting all the data points and communication to one single device. So we call it the care team communication. So essentially combining nurse calls and smart talk, which essentially still a lot of hospitals are still using deck phones and pages. Moving forward, we're seeing a convergence on that piece itself. So with the device, increasingly we're seeing a lot of reliance in accessing a lot of information. As you can see over here, there's so many things that you can do on a large screen, 5-inch display device that is healthcare rated coating as well, which I'll talking about in a short while. But essentially, everything is in there. You don't have to deal with so much of paper, and of course, paper is one thing that's it's a bit dangerous when we talk about cross infections, potential of cross infections, which mobile solutions is still the best way to move forward in combining and pulling all this information in for the healthcare worker itself. So again, we talk about the 5 rights and 6 rights. This is one of our solution where it's been used in a lot of the hospitals for medication administration. In the future, we're seeing trends of driving this use of handheld devices into more extensive use. For example, people locator. As I mentioned earlier on, an aging population needs a different solution. So people locator, even baby locators, it's a requirement by some of the healthcare organizations that we work with. So they need to actually streamline the environment to identify where their dementia patients are. So that is one of the main requirements that we're hearing so far from aging population challenged countries. EMR, extensive use of EMR and communication, as I mentioned earlier on, is extending the use of talking to kind of like looking at the patient's data, vital signs, but at the same time, accessing a lot more information and um, not just beyond the hospital itself, but extending out of the hospital, talking to the patient's family just immediately. So doctors don't need to go through a computer and look up for a patient's family contact number, but through the device immediately can call up and share the information with the patient's patient's family itself. So all in all, we are seeing a lot more extensive usage of a device moving forward. So that would actually conclude the device, the mobile device itself, where today we are offering on our portfolio 3 different types of solutions, essentially an iOS or Apple focused solution, the SL42 SLED, and the Android versions of the healthcare device, which is CD40 Healthcare and the ED51 Healthcare. So both are actually designed for Android, but the best solution is actually the CD40 Healthcare. Essentially, it's fully certified, and of course, I'm going to talk a little bit about the encryption part, which is essential because there's one area that we talk about patient safety. Patient's data is our obligation or our requirement to protect them. So safe and secure is key to our patients. Holistically, Honeywell looks at it from all angles, so not only from patient safety, but also from data security standpoint. Um, so the healthcare cybersecurity has been one of the largest, highest, impact in terms of hacking incidents. You may recall a few years ago, Singapore Health has been was breached. A concerted effort to actually breach the network, and of course to steal specific potential, or rather high level personnel's healthcare information. So that shows one thing. Even though Singapore spends a large portion of the budget in cybersecurity, we still get hacked. So in short, um, we must at least a minimum, to protect our patients' data, is to actually ensure that the devices that's been used are at the highest level of data security. With the introduction of the CD40, we actually enabled the hardware level encryption on this device, which is certified for the US standard FIPS 14021. Essentially, it's a US government computer security, cybersecurity standard for encryption. So it's at first level, which essentially no one is able to snoop, or rather being able to actually steal information, because this is point-to-point security, and is used at the level of banking sector and healthcare and finance. So those are very highly sensitive data, which we ensure that it's this is secure. And last but not least, we talk about tracking productivity assets. We're tracking the stocks, the stocking in the pharmacy at the same time, the labs, but at the same time also we want to make sure that we protect the assets that we have. As I mentioned earlier on, the solutions that we have are disinfectant ready housing. So this is a slide talking about the difference between antimicrobial um, coating versus disinfectant housing. Plastics, essentially, what it says is simply, as healthcare workers, we all know, um, periodically cleaning is the most effective way for limiting cross infections. That does not, so for antimicrobial, it's nice, but effective cleaning is still required. So all these solutions that we have are effective against all these multiple disinfectant and sanitization agents that we've tested more than five plus years. So in short, it is actually used in hospitals today that you see, and they withstand the rugged the robust useness of those chemicals. So in short, Honeywell do have a broad spectrum or broad portfolio to help our heroes today. So essentially, think of technology as an enabler, and drive the progress forward. So this is my last slide. I'd like to share a video on the next slide, which we'll play now.
Can you tell which of these mobility devices has recently been wiped down and disinfected? Do you know which of your clinical staff was the last one to use it? Can your IT staff remotely access these devices to troubleshoot without having to take the device off the nursing floor? You may not be able to answer these questions about your mobile devices today, especially if you're using a common consumer device. But with the Honeywell CT40 Healthcare Mobile Computer and Honeywell Operational Intelligence software, these are the types of insights and analytics that your organization can have to better manage your devices and how your staff uses them. The Honeywell CT40 Healthcare Mobile Computer is an ideal mobility solution for your organization that's built specifically for your healthcare environment and offers these key features. 1. EHR compatibility. We partner with some of the most widely used EHR providers to ensure seamless integration into your existing infrastructure. The CT40 Healthcare mobile computer is validated and approved for use with Cerner's CareAware Connect application. 2. Disinfectant-ready housing. Our healthcare devices are built to withstand harsh sanitizing demands of any healthcare environment without sacrificing the performance. A device that's already built with disinfectant-ready housing eliminates the additional costs you need for a common consumer device protective casing. 3. Longest device support lifecycle in the industry. In partnership with Google and Qualcomm, we've created the Mobility Edge platform that extends your mobile hardware lifecycle through Android 11, eliminating the need to reinvest in new devices every time a new OS upgrade is required and extending your total cost of ownership. And 4th, pair the Honeywell CT40 mobile computer with our operational intelligence software. This cloud-based solution enables deeper insights into your clinical workforce, from basic device usage tracking to detecting potential abuse of your company assets and more. We've added new features to operational intelligence in light of the global health crisis to give healthcare providers greater visibility over social distancing and implementing new sanitation protocols. Your mobility technology should empower and enable your workforce, not be a barrier or cause a frustration. With Honeywell's mobility solutions for healthcare, you can equip your clinicians and hospital staff with the right mobility tools they need to focus on what matters most, their patients. To find out more, schedule a meeting with us now.
All right, with that, I'll end my presentation. Hope that you guys enjoyed the presentation today. If you have any questions, do feel free to actually type in the questionnaires, and we'll address it in a short while. Aimee, I'll pass it on to you.
Thank you so much, Sir Freddy, for that insightful presentation about the healthcare trends and challenges, and then the latest healthcare innovations. And I must also mention the Healthcare Honeywell video. Thanks for that. It was a great and informative video. All right, so at this point, I'm sure most of the audience already have their questions in mind. So just to remind everybody, please use the Q&A box to type in your questions. And then we will address those questions at the end of all the presentations during the panel discussion. Once again, thank you so much, Sir Freddy. And now we will move forward to our next speaker. So for this presentation, we will actually be seeing a pre-recorded presentation only because of the time zone difference between Manila and Netherlands, where our speaker is currently based. But don't worry, because he will be joining us live during the panel discussion. To introduce the next speaker, in his role at Brunswick Storage Systems, he has been consulting partners and customers in Asia-Pacific region on how to optimize their storage space by creating space in the most sustainable way. With over 50 years of experience in space-saving storage systems, Brunswick claims to have the safest and most secure storage solutions in the industry. Everyone, let's hear it from Mr. Rick Linders of Brunswick Storage Systems.
You might have experienced a shortage of personal protective equipment or people that were stealing masks and other sterile supplies in your organization. After recent and current happenings in the world, we saw an increased need from organizations like yours to store a larger amount of stock at own premises, to utilize their space more efficiently in need for additional space for beds or stock, and to keep stored items better protected against theft and only being accessible for the right people. What does your organization do with these trends? Good morning, magandang umaga. My name is Rick Linders and I'm Area Manager Asia for Brunswick Storage Systems. At Brunswick Storage Systems, we organize your space. And we do that by providing the safest and most sustainable space-saving storage solutions. The history timeline of our company Bruinzeel was founded in 1897 and has been in business for more than 120 years. Our headquarters and production facility is located in the Netherlands in Panningen. Furthermore, we have 9 sales offices in European countries. Besides that, we cooperate with 52 distributors in 50 countries. And for the Philippines, we have been in a long-term cooperation with Prime Sales, and we have conducted many successful projects together. Our products and accessories. We help our customers by supplying our electrical and mechanical storage systems. And in the slide in front of you, you can see at the top our electrical systems and at the bottom our mechanical systems. Besides that, we offer a large selection of static and mobile shelving and cabinets. And for instance, an example, the airtight cabinet that you can see in the middle top, and that you can use, for instance, for the storage of medicines. And there are many accessories that can be combined or integrated in our systems, and a few of them I would like to highlight. For instance, the integrated drawers, which you can see on the right bottom. You can use them for storing different types of products like medicines, sanitizers, all kinds of medical disposables. And these integrated drawers come in different sizes and forms. The same goes for pull-out trays and baskets, which you can see at the left bottom. These also come in different sizes and forms and are used for storing different kinds of products. We also have solutions for hanging files if you as a customer are storing X-rays or patient files. But we also have solutions for hanging catheters. And many more accessories, really depending on the needs and wishes of you as a customer. We see very diverse and different things being stored in the healthcare industry. Of course, it depends if you are talking to a hospital or if you are a nursery home or a pharmaceutical company. In general, that goes from archiving of patient records and X-rays to the preservation of medicines. And other examples of things that are often stored are medical supplies, drugs, documents, face masks, surgical instruments, laundry, medical disposables. So all these kind of products are stored in our systems. We have listed the most important arguments in the industry from our experience. And first of all, hygiene. And in an industry like this industry, hygiene is a very important argument. Concerning storage systems, we see that often means cleaning procedures, meaning the ease of using and cleaning a system. Additionally, it also means overcoming rust. Secondly, safety. Many of our customers want the most safe environment for their employees to operate in. Accidents should be prevented and cannot happen during operation of the system. Additionally, it also should prevent stored items from falling down. Thirdly and fourthly, accessibility and security. You can probably imagine that an often heard argument is that you as a customer want the right people to access the right products. It goes from confidential document storage to the storage of valuable medicines and drugs. These items should not be accessed by the wrong people. Giving our customers the option of securing their products and make it accessible for only the right people is therefore of great importance. And last but not least, storage capacity and ergonomics. An efficient working environment is often considered of large importance as healthcare workers prefer spending as much time possible on patients. And by optimizing their storage capacity, we give them the possibility to store as much of their storage needs as close by as they need, which will lead to better efficiency for them. And ergonomics often mean the ease of use and the ease of operating a system. Here you can see some references in the healthcare market, and you can see that it's well spread between the Far East, the Middle East, and Europe. So there's many examples of projects that we have conducted in hospitals, but also in pharmaceutical companies, in nursery homes. So there's different kind of organizations that we have helped. And there's a few examples that I want to highlight and speak to you a little bit more about in depth. And the first one is the OLV hospital in Aalst in Belgium, and they had experienced a period of rapid expansion over recent years. And as a result of that, they faced a lack of storage space for the storage of medical equipment. And through the installation of our mobile storage system, we were able to double this hospital's existing storage capacity. And by delivering a system with shelves, drawers, and modular baskets, we fulfilled their requirement to store different small objects. They also wanted to store the heavier goods and make it possible to retrieve them easily. Herefore, we have supplied the customer with a special custom-designed hanging frame in which modular baskets for heavier goods could be placed. It won't surprise you that being able to store different products in a system was the most important argument for this customer. Besides this argument, safety and ergonomics were important. Safety to them meant preventing everyone to access the products, which has been solved by delivering our dynamic system with access code. The access code works in that way that you set a certain PIN code, and once people press that PIN code on the user interface touchscreen of the panel, then that specific aisle can open. You can set a different access code for every different aisle. With ergonomics, they meant the ease of using the system, as it had to be very easy to operate for the staff. And by offering our electrical system with our user interface, you only need to press one button or one tap on the handle, and automatically the right aisle will open for you. The second example that I want to touch upon is a hospital in Sweden. In this project, we delivered our Compactus mechanical system to the surgery department at Skin University Hospital in Malmö. This system is used as storage for emergency surgeries during evenings and weekends. And the new storage system replaced an existing older storage system. As you probably can imagine, in an emergency surgery environment, speed and accessibility is of high importance. In the old situation, there was a storage room with one system for anesthesia, tools, and accessories combined. And this resulted in waiting for each other to pick all the material needed for the surgery. And that was, of course, not ideal, as the staff often is in a hurry. In their new room, they chose to separate anesthesia and other products. And we have been able to help them with that. The purple-pink storage included a small fixed section, in which they always have quick access to blood products and sutures. And in the mobile part of the system, they stored instruments, screws, plates, pin, and prostheses. And in the blue system, anesthesia has all its accessories. What brought that to the customer? It saved them a lot of time, which is of course beyond important in an emergency surgery department. The third example is the Shannon Hospital in Hong Kong. And the Shannon Hospital in Hong Kong is storing medical records and X-rays of patients in the most efficient way possible. Focus for the customer was very much on accessibility and safety for their staff. The reason why the customer chose Bruinzeel was that we could deliver our newest electrical system with double safety feature to ensure absolute safety for their staff to work in. I will tell you a little bit more about the double safety feature. First of all, we have the photo cells, which come on the base of our system, which is basically a laser line. And once that laser line gets interrupted, the system automatically stops and retrieves, and you will receive an error code. And the second safety feature that we have is the safety master, which you can also see in the slide in front of you. And that is basically a camera that detects if someone or something is standing in the aisle. And if so, the system automatically stops moving, and you will get an error code and receive a notification on your mobile phone. What is important to know that both of these safety measures are considered active safety measures, meaning that the person standing in the aisle will not touch the system at all. These two measures will notice on forehand that someone or something is standing in the aisle, and it will stop. And the last example I wanted to tell you a little bit more about is the case study of Nomeco in Denmark. And Nomeco is Denmark's leading medicine wholesaler and distributes approximately 70% of the medicine sold through Danish pharmacies, together with a significant proportion of medical products used by Danish healthcare organizations. By delivering our mobile system, we made it possible for Nomeco to meet the stringent requirements for storage of materials used in clinical trials. The access code guaranteed that only authorized staff can access the system. And the installation has 6 sensors that measure and control temperature and humidity. And the advantage of choosing our system for them was, of course, to maximize their storage capacity. Additionally, should additional storage be required, this system is very easy to extend. As you can see in front of you on the slide, as the front panels are really customized upon the wishes of Nomeco. You have already heard a few examples and arguments and criterions why customers have chosen for our systems and why we have been able to help our specific customers. But here again, the most important reasons why our customers choose for us. First of all, our mobile system. Our mobile system ensures the most efficient storage way possible. And if space efficiency to you as a customer is very important, then we can help you with that. Furthermore, it's also important to know that our systems are 100% powder coated, which is often considered very important in the healthcare industry. The second one is the access control, which I've already explained to you. It works via a PIN code or via an RFID, which you can set yourself by using the application. Thirdly, the customized solutions. And customization is all about delivering the right solutions for the needs of you as a customer, and the possibilities, of which I've already shared a few with you, in Bruinzell are endless. We are flexible in length, in height, in depth, in color, and so on. So we can basically really customize a solution based on what you need as a customer. And what we see in the field is that, especially in the hospitals, they are storing different kind of products and accessories, and they need a customized design for that, and that is something that we can definitely deliver. Fourthly, you see the anti-theft, which is a little bit in line with access control. An anti-theft is a mechanical solution that prevents people from getting in. And now I see you're thinking, what does that mean then? Because with the access control, people are already prevented from getting in. That is completely true. However, some people might try to push the bases out of each other, and even though they might be very strong, they will not succeed. Our anti-theft mechanical solution will make sure that will not happen, and the alarm will go off and you'll receive a notification via the application. So you see the user interface, which I have already explained to you before. It's a touchscreen on the front of every base, and by using that touchscreen, you can move the system, or you can set certain things on the system itself. Last but not least, energy saving. Our user interface has colors in it and automatically pops up when you're standing in front of it. If the system is not used or operated in the last 15 seconds, it automatically turns black in order to save some energy. Would you like to know more about Bruinzell or the Bruinzell products? Please do contact our distributor Prime Sales, which is our exclusive distributor in the Philippines. And as mentioned before, we have been cooperating with them for more than 15 years. Of course, you can also have a look at our own website, which is stated below. And if you want to visualize our solutions, please do have a look at our YouTube channel. This was it for now. I believe in a bit there will be a panel in which you can ask questions if you have. Please do not hesitate to ask them to me. And for the rest, thank you very much. Maraming salamat.
Okay, thank you so much, Sir Rick, for sharing your expertise on how we can help the healthcare industry transform their storage spaces. I actually like the part wherein we heard the stories of how other healthcare companies and organizations, both the hospitals and then the pharmaceutical from across the globe, were able to implement optimized storage solution, which actually delivered them the great efficiency. And we are all excited to hear it live during the panel discussion, which is now about to open. Once again, a great thumbs up to our speakers today, Mr. Freddy Fab and Mr. Rick Lunders, for sharing your expertise to our audience today. Okay, so to our participants, I would just like to inform you to please type in now your questions in our Q&A box, since our panel discussion is now open. And we will try to answer your questions. But for those that we can, we will address those in email and send it to you within the next 24 hours. All right, so at this point, Sir Freddy and Sir Rick, please join me now in your panel discussion. Can you check if you guys can hear me loud and clear? Sir Freddy, can you hear me?
Yes, I can hear.
How about you, Sir Rick? Hello?
Yes. Hello. Yes, I can
Hello?
hear you. Can you hear me as well?
Yeah, loud and clear. Welcome to the webinar.
Thank you very much.
Okay, so we have here a few questions. First one is addressed for Brunzil. What happens when the electrical system is not working in case of a power failure? Sir Rick, please take this question, please.
Yes, that's a very good question, of course. Well, what we do, we supply our systems with a battery backup. So in case a power failure is happening, then the system automatically switches to the battery backup and can still be operational.
Okay, all right. Sir Rick, I'm just curious. I understand that the Brunzil storage solutions are actually coated with antimicrobial, but are your storage solutions also able to withstand the industrial disinfectants? Hello,
That's
Sir Rick?
a good question, Aimee. Can you be a little bit more specific about industrial substance?
It's the typical disinfectants that we use, usually like bleach, as an example.
That's a good question. It's difficult for me to answer straight away, so that will be something I need to look into it.
Okay. Anyways, let's proceed to the next question. What if we are storing products or items that have not been mentioned during the presentation, meaning apart from the typical things that are being stored in the hospital, this specific organization has a different types of requirement? How do Brunzil deal with that?
Yeah, I can imagine that is a relevant question to the audience today. And that is, of course, no problem. We have basically stored everything that you can imagine in a hospital or in a pharmaceutical company. Maybe you have not seen that specific example during the presentation, but we have many more examples of things that we have stored. In case we have not made or created the solution before, we will definitely do that once we get the request.
All right. Thank you so much, Sir Rick. Now I have here a question for Sir Freddy. What will happen if we don't use a non-disinfectant ready device?
Yes. So there's a very common question that comes about. Essentially, the normal plastics are used basically designed for drops and whatnot. They are not able to actually withstand the kind of harsh wipes, and after a while, these plastics become brittle. So, like for example, even our day-to-day devices, we have to be very careful in terms of using disinfectants, especially the alcohol-based kind of disinfectants to clean our phones and so on and so forth, because it does actually corrode the plastic a bit. And the minute you will only see it or the difference after a while of cleaning when you start it's either melting or cracking incidents will occur. That's one. That's addressing the plastic itself. Number two, the connectors. The connectors that are not designed to withstand such chemicals will start to corrode. That means we have seen our customers having difficulty in charging some of these devices because the connectors has formed a layer of corrosion, and it cannot come in contact in terms of charging, and thus having a lot of issues in charging. So again, in this kind of environment, when we talk about disinfectant, is disinfecting the devices or anything in the environment is a standard procedure. It's highly recommended to use disinfectant ready coating, or rather the plastics and the connectors.
Just a follow-up question, Sir Freddy. Is there a LTE, a 4G version of such healthcare mobile devices?
Yeah, so that's also a very interesting question because recently we're seeing quite a number of requests in relation um, to the use of these devices outside the hospital, especially when we talk about field hospitals and remote site diagnostics or infection testing, right? You want the device to be out there, and you don't want and you don't have any Wi-Fi infrastructure. In remote areas, you still have connectivity for such devices with the LTE version or the 3G or sorry, the 4G version of devices, so that it's always remaining connectivity. Now, that being said, not many providers are able to provide that because we're increasingly seeing we were first to actually release such a solution in the market.
Mhm.
We were
Okay.
quick to pivot to this requirement.
I see. Sir Freddy, there you have mentioned in your presentation the nurse call and then the smart talk solution. Can you please reiterate what's the difference between the two?
Okay, that's a very good question as well because in the healthcare industry, when we talk about nurse call team communication, we talk about various types of communication. Nurse call addresses the codes in healthcare, and the codes in healthcare is the healthcare attendees on this call would know the code blue, code white, code silver, code orange. Those address internally in the hospital the various codes that's related, that the incidents that's happening in the hospital. Now these codes are essential where we talk about routing of these codes, the alerts to the various healthcare workers skilled for that kind of alert. So that not everyone receives it and redirecting it to appropriate people. Thus handling what we call, or the industry calls it, the alert fatigue environment, where essentially there's so many alerts going on, right? And suddenly everybody's so tired about hearing alerts in the environment. So that's nurse call, handling such codes, um, those high level codes in the hospital. Smart Talk is a so-called a communication tool that enables a connectivity between the hospital and the outside recipients. That means talking to the patient's family, or even receiving emergency calls from the external, rerouting it to the doctor within the hospital using the same device. That's essential. So imagine an emergency call outside, calling the landline in a hospital and rerouting that through Smart Talk to the device. So that's one use case. The other use case is that messaging, secure messaging. Smart Talk has secure messaging and video conferencing, where we talk about telehealth. And of course, first responder communication. That means if there's any incident, emergency incident, the first responder is able to connect with a emergency doctor, the doctor that's on duty on emergency, and have and address the concerns on the spot, and do the relevant triage on the spot with the first the emergency responder.
All
So
right. Thank
those are two different systems altogether.
Thank you, Sir Freddy. I'm actually seeing more questions now from our audience, and these are kind of interesting questions for Sir Rick and Sir Freddy. Question from Miss Sasiba May and Cajas. With the budget constraints of most the government hospitals, keeping up with the latest trends in healthcare system could be very costly. Would there be any other intervention we could do without spending too much? How am I going to do this? Sir Rick, would you like to take this question, please?
Yes, I will. It's maybe a quite general question, So what
What's your thought about this one?
sorry?
What's your thought about this interesting question?
Yeah, it is a good question. It is also something that we definitely see happening in the market. What I can say from our perspective, from the Bruinsel perspective, is, I mean, we have different kind of systems. We have a mechanical one and an electrical one. It's very durable. It's very sustainable. That is often a requirement for instance, hospitals in Europe. So yeah, the return on investment, let's say, is higher when you have a system that stands there for 25 years than a system that you have to replace every certain amount of years. Still, I can imagine that that is a or an important topic, and yeah, as mentioned, we can deliver different kind of solutions for different kind of challenges, and also economically wise, that comes with different pricing. So there's also always something that we can look into, but I can imagine that that is top of mind for healthcare organizations right now.
Thank you, Sir Rick. How about you, Sir Freddy? Any thoughts about this question?
Yes. So Honeywell operate in Honeywell. Okay. So let's rephrase this. We are a international company. When I say international company, basically we operate in all kinds of environments. So matured markets and emerging markets. And we invest a lot, especially in emerging markets. So we invest a lot in India, in China, and so on and so forth. We know the constraints of the budgets within the emerging markets, and that's why we do have a different set of solutions that's designed for environments like ours in the emerging markets. So in Philippines, it's considered as an emerging market. We have cost-effective solutions, bite-sized solutions that helps countries to actually tap onto this technology, and don't need to be, implementing the best of the worlds like Senior or Epic solutions that is worldwide present, but we do have smaller, lower scale kind of solutions that addresses specific requirements for emerging markets. So we do have those, so we can take the discussion in detail and look into how we could actually help.
Thank you, Sir Freddy. Oh, also there is an anonymous attendee addressing a question to Honeywell. Is the healthcare trends presented by Honeywell already implemented by hospitals and or clinics here in the Philippines?
Yeah, the trends.
Do you have any idea?
Yeah, the trends in overall we've seen in Philippines is actually the first one is I'm actually more concerned about the EMR piece, whether or not that's been implemented, because that is a very large initiative, and individually from a public safety, from a public health system perspective, question is whether or not an EMR has been implemented. It took Singapore years to actually consolidate that piece together. If not, the individual hospitals will have that kind of solution. That would mean they have more or less implemented some, but we don't see all that has been implemented in the Philippines today.
Thank you, Sir Freddy. Sir Rick, I'm just curious about this one. How do you think the Brunswick storage solutions will be able to contribute to the issue of patient record safety, especially for the COVID-19 patients? How can Brunswick storage systems can, in a way, provide the ease of mind for the healthcare organizations that they will be able to provide a certain level of safety to the patient records?
Thank you for the question. Well, probably I can best mention the case that I've also shared during my presentation, which is the Shannon Hospital in Hong Kong, which we have installed recently. And this customer had exactly the same requirement. And by using our electrical system, you can basically set your own PIN code per different aisle. So per aisle, you could have different people allowing to access that specific aisle with that specific information. So So that is one of the main reasons, I would say, why customers with this requirement choose us as their partner.
I see. Thank you so much for citing a specific example for that case. There is another question here from Miss Daisy Sembrano. Pfizer's COVID-19 vaccine seems ahead of most in terms of timelines, but is said to require ultra cold conditions. Do you think, guys, we are ready to take on this part of the world? Sir Freddy, would you have some thoughts about this question?
Yeah, sure. So the first thing first is that there are dozens of vaccines that's in development, are in R&D. Pfizer's vaccine is first to come out, being one of the most effective ones. I mean, you're talking about Pfizer or so many, right? So many vaccines that's in production. So we do not know exactly what the rest would the storage requirements would require, but it's indeed require a very, very harsh deep cold environment, which is basically, I believe, if I recall correctly, it's minus 60 degrees. So it's beyond a lot of the environment that we operate in, even for our traditional food cold storage, which is
Correct.
basically
Yeah.
to minus 30. It's double that low temperature. So I would say that there is a difficulty in distribution for that kind of because we don't have that kind of infrastructure to hold, even for specific for Philippines. You will have a much more difficult distribution challenge there, because you got so many islands to reach out to and so many people. So essentially it is difficult to distribute. So I guess the answer would be, let's wait and see the next few vaccines that's coming out, which we would expect to see or hear more in the next 2 months.
Thank you, Sir Freddy. Sir Rick, do you have additional thoughts on this question?
No, I mean, nothing to add there.
Okay, thank you. Just last one question specifically for Honeywell. In what ways can Honeywell Solutions provide a feasible solution to the current trace and track efforts against the COVID-19 pandemic?
Sorry, could you repeat the question again, Amy?
Okay, so one more time. In what ways can the Honeywell Solutions provide a feasible solution to our current trace and track efforts against the COVID-19 pandemic?
Okay. That's I actually took out one of the slides because I thought that no one would be interested about it today. So we do have a solution that is plug and go to help you actually start to do remote tracing and of course to do testing on site. So you can talk to our local reps on a call, and we can address it further. So we do have a software and a device to help you to do that.
Thank you so much, Sir Freddy. And I think that's it for our panel discussion, because we're quite running out of time and there is no more question coming in from our audience. But please, to our participants, if you have questions in mind that will come after this event, please feel free to reach Prime Sales, Honeywell, and Brinsil, and we will definitely be coming back to you to answer your questions. Okay, so our time is almost up. Let's wrap up our webinar. Thank you, Sir Freddy and Sir Rick, for joining me in the panel discussion and for answering all the questions from our participants today. And again, thank you to our dear audience for being with us today. We will share the presentations and then the recordings to you in the following days. So please watch out for post-event emails. So thank you, everyone, and our heartfelt salute to all our frontline heroes. Mabuhay po kayong lahat. Once again, this is Amy Benaflor from Prime Sales Incorporated, your host, signing out. Have a great day, everyone. Bye-bye.
Thank you, everyone. Bye.
Thank you, everyone. Bye-bye.